Hi, this is Chris from Petability. Today I'm going to show you how to do passive range of motion of your dog's hind limb. It's important to be methodical so that you don't miss a joint as you're going. I prefer to start on the back side or top of the dog. You may prefer the bottom, but either way, just make sure that you go through in a segmented way. So the first place that I'm going to start is at the dog's pelvis. I can feel a bone up here. That is the top of their ilium. And I can kind of push that down. Here is their sit bone, ischial tuberosity. I can push that forward or capture both of those and do kind of a rocking motion. As I mobilize and range the pelvis on the top side, because Libby here is lying on the ground in a relaxed fashion, she's also getting mobilized on the bottom side at the same time. Great way to start introducing your touch and getting your dog to relax. To find your dog's hip joint, if you take your flat hand and come along the lateral or outside of their thigh, you'll feel a bump, a dense area. That tells you exactly where their hip joint is. Now again, you don't want to confuse that with the bone they sit on or the bone along their back, which is part of their pelvis. Those three bony landmarks actually make a triangle. So when I'm trying to find the dog's hip, I'll just come in from the outside, press down, and there it is. When I'm doing hip flexion, I'm moving Libby's thigh up toward her belly. So my top hand is providing some stability. My bottom hand is moving that segment toward her belly. Going into extension, I can pull back this way and open up her hip into extension. So flexion, extension, flexion, extension. Sometimes if I really want to work on flexion because that seems stiff, I will keep my hand in this position and just go from relaxing to more of an acute angle, closing that hip joint into flexion. If my emphasis is extension, I switch my hand placement, again stabilizing at the top proximally, moving my hand down the front of her thigh and opening that hip up into extension. So again, relax, extend, relax, extend. Trying to go comfortably to each end of the range of motion. The next joint in the line is the knee joint or stifle. So again, I'm going to put my hand above and below the knee joint and fold that joint, closing it down into flexion. Then my right hand is actually pushing that into extension. My left hand is doing most of the work to flex. Right hand, extend, and so forth. Now again, I could switch my hands to really emphasize and make sure I get to that end range of extension if that's a goal. Now we're at the tarsus or ankle joint, or some call it the hock. It's equivalent to our ankle, and it also opens and closes, flexes and extends like the knee joint above. I always want to have my proximal hand relatively stabilizing and my bottom hand doing the movement. It's normal for your dog's ankle or tarsus to also have a little bit of movement in and out, but the primary motion is up and down. Next, we're going to move to your dog's toes. There are 4 digits. These little toes take a lot of pounding. So normally when the dog is standing, they need that full extension to fully weight bear on the ground. It looks like this. If your dog's toes can't do that, then that's altering their biomechanics. But let's not forget that the toes also bend the other direction. So you can take them as a unit and bend them up and down, or take each individual toe and move it. Sometimes I will do a little bit of tugging. That feels good and can release some some stiffness. And finally, I will spread or splay the toes. Weight bearing not only extends, but splays the toes.